So, hello everyone. I'm so proud to be in front of you as a consecrated, and we would like to present a model. Here we can see three sisters. Those are focused in Eucharist. Actually, Holy Eucharist or Jesus is the center of consecrated life. And as we are moving away from God, different types of issues may emerge in our consecrated life. So, the first sister, she represents young adulthood from age group of 18 to 39. Again, it is middle adult group. It is from 40 to 59, and the third sister is of old age, that is 60 plus age group. So the middle adulthood, that is a period when we have just came from our home, so they may be having some attachment issues with house or feeling difficulty to detach from the home, and they may be having different problems like conflicts, confusion, fatigue, peer pressure, etc. Again, when we are coming to the middle age group, it is a period of after menopause, so emptiness, loneliness, middle age crisis, anxiety, etc. Some characteristics of middle age group. Again, when we are coming to the old age, it is 60 plus. Actually, it's a period when we are reflecting over our past life, and also we are thinking about death. So in a very usual manner, that anxiety may emerge. Then it's a period of reflection, self-doubt, insomnia, guilt, disconnection, and so on. Again, you can see three posters in front of us. The middle poster, it represents a focus group discussion and its findings that we have discussed. 12 superiors from 12 congregations has participated in this focus group discussion. As we know, we are consecrated. We are supposed to serve Jesus or love Jesus and serve the people for God. But actually, all the consecrated or all the candidates who are selected, they are supposed to be of good mental health. But after coming to the congregation, actually what is happening to them? Some issues are related with that. It is depicted here. And the mental health status of the present religious men and women is very much deteriorating in this modern age. Especially the diocesan priests are found to be more stressful and anxious than the congregation priests. Again, when we are thinking of the religious women, 74% of religious women is found as anxious and stressful. Again, the repeated suicides that is committed by priests and nuns is also a shocking news. Actually, these background facts made us curious or made us aware and alertful in order to conduct a study of regarding the status of mental health of religious. And again, when we are coming to the conceptual map, we can see four phases of religious life: our prayer life, our community life, apostolate life, and the personal life. When we are thinking of the prayer life, it includes the sacraments, personal prayer, community life, community prayer, and so on. Again, when we are coming to the community life, there comes the relationship with the superiors, with the members, and also with the congregation. When we are thinking of our apostolate life, it has the qualifications or skills that we should have, and also the service that we are providing, and again the division of labor. When we are thinking of the personal life, it has three levels: body, mind, and also the soul. Issues in any one phase can always influence or impact other areas. Again, based on the findings, we have depicted the main manifestations of different problems in prayer life, community life, and apostolate life. When we think of the prayer life, they may be having occasional crisis, much of questioning, existential crisis, lack of faith, and so on. Again, when we come into the community life, it will be very evident in our community, maybe some disagreements, conflicts, isolation, withdrawal from the community activities, and so on. When we are coming to the apostolate life, the main thing is our occupational stress, then negative competitive spirit between the community members. So again, now let's see the causal factors of different problems.
Coming to the causal factors of psychopathology, there are mainly four perspectives. First perspective is biological causal factors. Biological causal factors saying that the hormonal imbalances and genetical factors, these all factors contribute to psychopathology. And the second perspective is psychodynamic perspective. And it is a perspective that is mainly put forward by Sigmund Freud. And Sigmund Freud says that unconscious repressed thoughts or desires that leads to the psychopathology. And also there is attachment styles, different attachment styles like anxious, avoidant attachment styles. This all type of attachment styles that may also contribute to the psychopathology conditions. And coming to the learning perspective says that we learned a behavior through observation or modeling. If you have a like of appropriate role models, that may also lead to psychopathological conditions. And coming to the socio-cultural perspective says that based on different cultures, such as their prejudice, their discriminations, these factors may be contribute to psychopathology. And one of the main perspective is cognitive behavioral perspective. Cognitive perspective is a cognitive model, this CBT that is put forward by Aaron Beck. Aaron Beck and all the cognitive models saying that this cognitive dysfunctional beliefs and dysfunctional thoughts that may lead to automatic dysfunctional thoughts and that may contribute to psychopathology. These are the main etiological causal factors that may lead to psychopathology. And coming to the solutions, the major solutions identified by the 12 superiors in the focus group discussions is that first one is we can develop a spiritual sharing and integration properly to all the community members, and also we can conduct awareness classes about different mental health problems and mental health issues, and also we can devote a particular time for our own passion. If you are passionate towards drawing, towards singing, towards dancing, please please find out some space for our own. So that may increase our mental health capacities. And also we can go for batch gathering or peer support. This all, if we have any problem, we can discuss with our intimate persons. That may also boost up our abilities, and we can able to cope up with these mental health issues. And these are the major solutions that identified by the focus group discussions that we conduct. Through these ways, we can have a greater consecrated life and an enjoyable consecrated life with Jesus. Thank you.